Hello again. Now, the COVID-19 outbreak has had a negative impact on the country's fight against HIV/AIDS. As a result, South Africa is now playing catch-up on the targets made with regard to antiretroviral distribution. But the Health Department says it has plans in place to reach its targets, as it did with COVID-19 testing. So how far have we come then in terms of eradicating HIV/AIDS? How far are we from those targets, which are very important? Let's discuss this now with Professor Quarrashia Abdool Karim. She's an executive director with CAPRISA. Prof, good afternoon. Thank you very much for your time. Is South Africa lagging far behind?
Well, I think that South Africa has made great progress in certain areas and in others is lagging behind. And I think that needs to be put into context in that South Africa has less than 1% of the global population, but bears a disproportionate 20% of the global burden of infection. So anything we do in South Africa and has a disproportionate influence and impact on the global pandemic, but also what we do compared to other countries counts for a lot more as well.
Yeah. So demographically, where is the biggest challenge? Is it in the youth? Is it in young women? Exactly where is the biggest challenge?
Right. So the theme for this year is equality. And I think part of the reason for that is that we've made a lot of progress in reaching people who utilize health services. And in the process, we identifying there are large communities across different ages and sexes and gender identity who we're not reaching. And so part of that relates to stigma and discrimination. Part of it is around ability to access the services, and part of it is also about who and when services are actually operational. So overall, one of the unique characteristics we have is the disproportionate burden of infection in young women. In fact, one of the shocking statistics just released by UNAIDS is that every 2 minutes in sub-Saharan Africa, we have one new infection in young women between 15 to 24 years. And so when we look at that, it's not just that young women in that age group is getting infected at such a high rate, but we've also described how they're getting infected from men over 25. And there are large numbers of men over 25 who have not tested and are not on treatment programs. And, treatment has both individual benefits, but also in terms of preventing onward transmission. And so breaking these chains of transmission, the cycle of transmission, requires a much more comprehensive approach. And that reducing infection in young women has many, many strategies that we need to focus on.
What about the gap in terms of people who can access treatment and those who have stopped their treatment?
So in South Africa, mostly people who've been initiated on treatment tend to remain on treatment, and we have good viral suppression rates. But I think with COVID, what we saw was a major setback in terms of testing and initiation of treatment in terms of new cases. So if you look at the number of new infections that we saw in 2021, it's about 1.5 million people got infected with HIV globally. And as I said earlier, quite a bit of that, about 20%, is in sub-Saharan Africa. So with COVID, we saw a break in terms of individuals accessing services for testing and treatment. But those who are on treatment remained on treatment. And we had various strategies like multi-month dispensing that helped. And now I think the challenge is really about strengthening our testing and new treatment initiation efforts.
Yeah, I was just about to ask you what South Africa should do now with its treatment plan. I mean, what new stuff would be required with the lessons of the impact of COVID-19 and the fact that, as you've said, many young men above 25 are not testing or accessing HIV/AIDS facilities. What should change? What should be the new priority areas in the country's treatment plan, in your view?
So I think that we are learning that we can't treat our way out of the epidemic. And I'm not saying that we don't have more to do on treatment. Treatment is important for the individual survival benefits. It's also important in terms of onward transmission. But our rates of new infections are much higher than our treatment initiation rates. So we got to focus on primary prevention and to continue to enhance our treatment program, particularly focusing on, for example, mothers who arrive at health services to deliver babies without any prenatal care. We have to look at how do we do better in terms of testing and initiating men on treatment, particularly those over 25. But we also have to do a lot better in terms of the prevention options we have, notably around the use of pre-exposure prophylaxis and encouraging people to test and then access those services most appropriate for them. Now, to do that and to meet some of the gaps that we have needs for us to do something different from what we've been doing. And we have to work much more strongly in partnership with everybody, and particularly with non-governmental organizations and community-based organizations that are in some ways more effectively reaching the populations that our health services are not reaching. And we've got to look at how we focus on that. We also need to do much more awareness raising. I think in terms of young people, our efforts on PMT-CT, reducing transmission rates from infected to mothers, have been so effective. We almost have a whole generation of young people reaching adolescence as an AIDS-free generation. And how do we make sure that we maintain them as an AIDS-free generation and do even better?
Yeah, the issue of awareness, I think, is important, especially targeted at young people, to also counter a lot of myths and false information that goes around. I mean, it always happens, and maybe also challenge some of the stigma. Now, CAPRISA is a research center of excellence in terms of HIV/AIDS in the country, and you are heading it up, Prof. From a research perspective, are there particular gaps, are there particular areas that you think you should focus on in order to provide more insight into the way forward?
Sure. So, preventing infection in young women is really, really critical and important. And we try and understand that in terms of the ongoing and evolving epidemic. We try and understand it in terms of the biological factors contributing to increased vulnerability. And we also evaluate interventions and new interventions. So, we did the first proof of concept in terms of pre-exposure prophylaxis. And today, most parts of the world, daily oral combinations of tenofovir and imdasitabine is widely available, including in South Africa. But that poses a challenge. And so a lot of the field has moved to more provider-initiated PrEP, where, for example, more recently we had data on the use of long-acting CAPRISA, which is a 2-monthly injection. And so when we move to these less frequent interventions for prevention, and particularly novel antiretrovirals, it's also where CAPRISA is trying to focus and fill that gap, and so too are others. The second is around a very novel concept of broadly neutralizing antibodies. And these a few individuals around the world who've been able to develop these antibodies that are much more potent than the traditional antibodies you get when you get infected. And so there's combinations of these antibodies that are being evaluated, including at CAPRISA, to see whether these combinations of antibodies can also prevent infection. The other benefit of such an approach is that it may help us get closer and smarter about vaccine development, which remains a challenge and is critical for ending AIDS, as is the cure agenda, and we're also playing a role there. The other fourth area that we focus on is around the excess deaths that we see in people who are co-infected with HIV and TB. And so when we have siloed programs, for example, just HIV programs, and we don't screen sufficiently for TB or other comorbidities, we can have complications setting in. And so we've got to do a much better job looking at the populations now on treatment, how they're aging, and what are the other things they may be experiencing, comorbidities, including non-communicable diseases, and do a much better job in terms of managing them much more holistically in terms of where they are in their health status.
Yeah, and how's the funding situation, I mean, for the likes of your organization, CAPRISA? And I've discussed with a number of other health professionals about other issues where monies, quite correctly at the time, were diverted away from those interventions in other areas of health challenges like malaria and others, and TB, to COVID-19. What's the funding like now for yourselves?
Right. So, most of the research funding coming into the country is actually from outside of South Africa. It comes primarily from Europe and the US. And I think that all member states to the United Nations committed to 1% of their GDP going to research. And there are no countries in Africa that actually meet that. It seems like a very modest, if anything, a low bar, but it tells you how much more we need to invest. And I hope that some of our experiences in COVID, and particularly the importance of local and regional manufacturing capacity, the importance of African-led research and African solutions for African challenges will certainly attract more investments from African governments and the private sector and philanthropic organizations to strengthen and increase the amount of money. And right now, we have a global economic crisis, and the first thing that's seen as a luxury is external aid and funding. And so I do worry that the research funding may be compromised and our ability to build on that. On the other hand, I think it's a challenge we have to be thinking about locally. How do we fill that gap and change it and ensure that we're doing the type of discovery, frontier research needed for the many challenges that face us and the millions of very vulnerable people we have in our midst, and where inequities and inequalities continue to grow.